Lumbar spondylosis. Let's talk about this in this video. Welcome back to my channel, and I hope you've been having a great time watching and learning something that you need for your everyday life. Today we'll be talking to you about lumbar spondylosis. And first of all, what does it mean? Basically means the wear and tear of the lumbar space, the region L1 to L5. Basically means wear and tear, of that particular part. And who are those that can have this condition called lumbar spondylosis? Well, we know that things are changing in the health wise, and then anybody can come down with any conditions now. But normally, it's said to occur between the ages of above 40. But now I'm seeing people that are even less than that's around 25 coming out with conditions, and that's because of I really don't know honestly, but I can tell you that's because of the one of the ways because of the postures that they are doing over the years. And some people can be structural wise or even genetic, which is a very important factor and a very important thing why people come down with this particular condition. Now, for someone that sits down for long, like I've been talking about in previous videos, the person may or may not come down with a particular condition. It depends. If the person is already predisposed to it based by the nature of where the family is coming, where he or she coming from family wise, he or she might have it based on hereditary conditions. It could be a trauma related condition or anything like that, or your job or things like that. But anybody at this point from around the age of 25 can actually come down with particular conditions. And what are the presentations of this particular condition? If you keep repeating or saying that you have low back pain, your walk, you've adjusted the way you walk, the way you sit, for a long period of time, and you keep having issues of low back pain repeatedly, you may or may not be dealing with lumbar spondylosis. It just depends. And why should you take note of this? Because if you don't take note of or take care of this particular condition early enough, the person might end up coming down with something called lumbar spondylosis with radiculopathy symptoms. Basically means that the pain that you feel from your low back is already the vertebrae are already being compressed, and then the nerves around that particular joint is being compressed as well, leading to sciatica like symptoms or stinging sensations down to your lower limbs. You might have heard someone that says that I have low back pain, person, serious low back pain, and then I also feel like I can't feel my legs on some days. I feel like I'm about to fall down. I feel like my legs are in Yoruba, it's something we call paja paja. So you have that feeling of paja paja, or you have that feeling of paresthesia. So yeah, you understand also. And then you feel like I cannot feel this particular part very well. I just feel pain coming down to my legs like that. The pain might not be from the leg, depending on the type of person he or she is and conditions associated with that particular condition. But just something be from your back, which means that the vertebrae is already compressing on the nerves, and then that's why you're having those symptoms. And this particular thing doesn't just get overnight; it comes with repetitive strain to the back. How that you can actually avoid strain to your back, and by doing this, the way you bend or pick up things, the way you live a sedentary lifestyle, different things can cause particular things. But the point is to ensure that before allowing those particular things to become ready to radiate down to the lower limbs, it's better for you to address it whenever you have low back pain. I'm not saying, oh yes, I am actually saying, whenever you have low back pain, don't just say that. Don't just brush it away with medications. Instead, go for a checkup. I know you might need to spend money again, but it's best for you to know whether this particular condition is going to affect you in the long run. I mentioned in particular shots about someone that's a patient that came in for a particular condition, shoulder pain, and then he ended up going back with preventive ways of managing a particular condition, to local spondylosis. That's because, and now that he already knows, actually, he can actually avoid it later in life. So rather than just trying to avoid medical abuse or medical or symptoms or conditions that you are afraid of, it's best to know what you're managing right now. So if you have something as little as low back pain, I'm saying it because low back pain is a very rampant condition, and a lot of people come down with particular things. They just feel like I worked a lot, and then I just need to rest. You can rest, you feel better, but you go back to that same thing again, and then you have pain again. You want to take medication every single day. I don't advise that for you, honestly. It's better for us to know what we're dealing with. So, see a physiotherapist for low back pain. The therapist will tell you to go for an X-ray, most likely, and then we'll know whether you have that condition, lumbar spondylosis, or it's queried. That is, you might have it later on. So we'll tell you what to do and how to prevent it. Now, why am I sharing this particular video to us in this instance? Is because we're in the age where people just decide to just use medications and avoid hospital bills, or because of the fact that they have to work a lot, remote workers or career professionals. I understand that you can be busy, but when you have something as simple as a low back pain, even ice is not the best treatment for you. Ice can help you to numb the pain right now, but we don't still know what the condition is all about. So rather than just trying to avoid and just use ice, what I'm telling you to use ice for whenever you have, just see a doctor, a physiotherapist, so that you know what to do, how to prevent. Better for you to start preventing a condition now than you for you to get to the future where you already need to do more things and then feel like know that you don't have back pain. So just go for regular checkups. You have back pain, check your back, check it out. You have symptoms going out your lower limbs. Check it out. Ask you know someone that has particular thing. Let the person go and see a physiotherapist so you will know what to do. And we have to also know that this radiculopathy is not just happening to older ones, it happens to even younger ones. So any feeling like something is moving down to your legs, please see a physiotherapist already. Don't try to numb it out. Don't try to hide the pain out. So if you know someone that's coming to your low back pain, the person is not on a period, the person sits a lot, the person walks a lot, the person is able to talk out, anything like that. Rather than telling the person to use ice, let me tell you what ice does. Ice is basically helpful when you have trauma injuries to the back, compared to when you just feel back pain. That back pain that you feel might not necessarily, ice can help it, but it's just helping you to hold off the pain for a period of time. Pain will still return. So just know what you're dealing with, what you need to work with, and what you need to avoid in the long run, and take a therapist and avoid back pain or back strain in the long run. And that's all for today's video. Don't just gloss over this. And until next time, don't forget to like, don't forget to share, don't forget to comment, and don't forget to subscribe on the long run. My name is Ifem Demolawa, and I'm the everyday physiotherapist. Until next time, bye.